Assalamualaikum and hello everyone. Welcome to PharmaTalk, where we answer real passionate questions using evidence-based pharmacy knowledge.
That's right. Today's episode is extra interesting because we are discussing a question sent by a patient online. And honestly, it's something many patients in Malaysia experience.
Joining us today are two pharmacists from our local pharmacy, and they will be answering a few questions from our online patients. Please come in. Okay, so this is pharmacist AMIRUL and this is pharmacist Ali.
Hello, my name is Muhammad Ali AFDHAL.
Hello, my name is AMIRUL HAQIM and I'm a pharmacist.
The first question from our viewer: I'm suffering from allergic rhinitis. My doctor prescribed me with Cetrizine, but when I went to another clinic, they gave me Clorpheniramine. Is there any difference between the two, and which one is the best for me?
A very good question. To help us answer this, Pharmacy Ali will tell us about Clorpheniramine, and Pharmacy AMIRUL will talk about Cetrizine. So, Pharmacy Ali, let's start with Clorpheniramine. How we pronounce it properly?
Oh, so you want to know?
Yes.
Yeah, we call it, as pharmacists, we call it Clorpheniramine.
Oh, Clorpheniramine.
Yeah.
So, what kind of drug is it?
Oh, I know when I explain this, it will be very confusing. For your information, Clorpheniramine is a first generation antihistamine that has been used for many years to treat allergy reaction such as sneezing, runny nose, itchy eyes, and nasal congestion. So, the other point is mechanism of action. Clorpheniramine works by blocking histamine at H1 receptor. This will reduce allergic symptoms. However, because it can cross the blood-brain barrier, it also affects the central nervous system. Also will make us feel sleepy because it has strong sedative effect.
So, that's very confusing. Talking about mechanism of action of Clorpheniramine. Is there any more additional information about Clorpheniramine?
Oh, so before we give the medication to the patient, we need to tell them about the indication and the side effect. So for the indication, it has 4 basic indication, which is allergic rhinitis, common cold symptom, other allergic conditions such as urticaria. Next, we're heading to side effect. There are some various side effects such as drowsiness and sedation, dry mouth, dizziness, blurred vision, and these effects are due to its anticholinergic properties. So for dosage, for adults, we recommend to use 4 mg 2 or 3 times a day.
Thank you, Pharmacist Ali. Now, let's hear about Cetrizine. Pharmacist AMIRUL.
Surely, Cetrizine is a second generation H1 antihistamine and commonly used today for allergic rhinitis. Cetrizine commonly acts by selectively blocking the peripheral H1 receptors in our body. It has minimal penetration into our blood-brain barrier, so it causes less sedative effect.
That's very informative. How about the indications and side effects?
Let me explain. For the indication, not just allergic rhinitis, we also use Cetrizine for seasonal and perennial allergic rhinitis and also chronic idiopathic urticaria. For the side effect, Cetrizine is generally well tolerated, and the possible side effects include mild drowsiness, headache, and dry mouth. But usually, most of these side effects are very rare. For the dosage, we recommend 10 mg once a day for the adult because this antihistamine is a long-acting antihistamine and can have higher and longer onset in our body.
Thank you for the information. Now, for the next session, we will compare both of the drugs side by side to help our viewer determine which one is more suitable for them.
Now, we'll compare the drugs side by side. Let's go! Woo.
Alright, for our first comparison, which drug has faster onset?
Let me answer this. Both drugs start working within 30 to 60 minutes, but chlorpheniramine may feel slightly faster due to sedation. However, Cetrizine provides longer symptom control as it has longer onset action.
Okay, so for children and elderly, which drug is safer for them?
Good question. For your information, chlorpheniramine can cause excessive sedation and confusion, especially in elderly patients.
Cetrizine is safer and preferred in children and elderly with proper dose adjustment.
How about for our pregnant mothers out there?
According to clinical practice, Cetrizine is generally preferred during pregnancy when an antihistamine is needed under medical advice.
Okay, next, the question that most of our viewers want to know, which drug is more affordable?
This is a very important question. So, for your information, again, chlorpheniramine is very cheap, widely available, and often included in government clinic and cold preparation.
Meanwhile, Cetrizine is also affordable, available as generic and commonly stocked in both government and private healthcare settings.
Okay, I have a question for our pharmacists. What does the Malaysian guideline says about Cetrizine and chlorpheniramine?
According to Ministry of Health Malaysia and also recommendation aligned with Academy of Medicine Malaysia, second generation antihistamine are preferred to treat allergic rhinitis because they have less sedative effect, they are safer for long-term usage and also improve the quality of life.
First generation antihistamine, such as chlorpheniramine, is not a first line agent, but it is still very useful when cost is a major issue, when the sedation effect is desirable or acceptable, and when a short symptom relief is needed.
So thank you both talking about the guideline Malaysian about both drugs. So, which are the best option for the patient?
There is no single best drug. It depends on patient lifestyle, age and needs.
If the patient needs to work, study or thrive, Cetrizine is more suitable. If cost is a major issue, short-term relief is needed, chlorpheniramine may be used, but with caution.
Okay, so before we end, let's reflect on our values and what we have learned so far in this discussion. Okay, so I will start with me. From this discussion, I learned that choosing medication must balance between safety, efficacy and patient lifestyle.
We also learned that shows why patient-centered care matters because different patients have different needs. So how about you, Ali?
For me, pharmacy personnel must be honest and ethical, explaining both benefit and risk clearly.
For me, being fair and evidence-based build trust between pharmacist and the patient.
Okay, that is all the time we have for today. Thank you for watching PharmaTalk.
Stay informed, stay safe, and always ask your pharmacist.
Thank you. Bye.
Bye.